Hello, I'm David Hutton of Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020, and I am joined by one of its presenters, Dr. John Hovanesian. Dr. Hovanesian, tell us about your presentation.
Yeah, thanks, David. It's a pleasure to join you. So the study that I'm presenting is called Patient-Reported Tolerance and Satisfaction with Intraocular Administration of Dexamethasone and Moxifloxacin versus a topical regimen. What we did is take a group of cataract surgery patients and we randomized one eye to receive a traditional topical regimen of eye drops, Pred Forte or Predacetate, moxifloxacin and Prolensa, and in the other eye to receive an intracameral regimen of Dexacu, which is dexamethasone intracameral, as well as moxifloxacin injection intracameral, and then topical Prolensa. So both groups had topical Prolensa once a day. We looked at patients at a variety of time points, with our primary endpoint being defined at 2 weeks, where we looked at their preference for which eye they preferred, the one that had far less drops versus traditional, pain, we looked at inflammation, and finally the cost that they paid out of pocket for these. And what we found, not surprisingly, was a significant preference with about 97% of our approximately 30 patients who preferred to have intracameral administration of drops. Simply much easier, the regimen was. As far as pain goes, about the same. We saw similar pain, and the other endpoint, inflammation, we saw similar inflammation. Summed ocular inflammation scores at 14 days showed in both groups a very low rate of inflammation 2 weeks after surgery. We finally looked at the out-of-pocket cost, and because intracameral moxifloxacin and dexamethasone, Dexacu, are not paid directly by the patient, the Dexacu is covered on pass-through reimbursement, and the Moxi is covered by the surgery center. Because of that, patients didn't have costs for those drugs. So there were significantly greater out-of-pocket costs, with more than 60% of patients paying over $100 in the topical group, whereas that same threshold was less than 10% of patients who had Prolensa alone as their topical drop. So in the end, it's clear that a drop-free or nearly drop-free regimen is very much preferred by patients, costs less for patients, and has similar performance in terms of controlling pain and inflammation as a regimen of traditional drops that we've used for so many years. So I think this represents a significant advance for us and for our patients and their experience in our practices. The take-home message is that as a profession, as a specialty, we probably should embrace the sustained release versions of eye drops that we've traditionally used as eye drops. So I think that for me, this affirms a suspicion I had that patients would really like going with less drops, and plan to continue it in my practice.